What was that?
Tank level so
No.
high.
But nobody should be on. We're only going to yes, so that can't let me do it.
Article.
That's what ours was. Trying to get this meeting started. Trying this meeting for November first. Starting it off with Tracy the second and Elo Hutchins.
Hi. Yep.
Yep.
Morning.
I've been called worse. And I'll assure you that.
Good morning. I invited Kyle Hutchins from the Anchor Group to join me this morning, of some of the things that I have on my agenda, in case you have some questions that I can't answer. Kyle is here to help with that. So number one on the agenda is a discussion about our HRA administration. So that's our health reimbursement account. Currently this year, well, for the last, I don't know, 6 years, I think, Health Now Administrators has been our TPA that manages our health reimbursement account. Health Now is a sister company to Blue Cross Blue Shield of Western New York. So last year, when Highmark Blue Cross Blue Shield bought Blue Cross Blue Shield of Western New York, they did not purchase Health Now, the sister company. So we are completely, right now with, we are on like our legacy platform. Next year, they're going to totally transition us over to the Highmark platform. So along with that, they have an HRA administration division. So they are going to take over our HRA accounts. Currently, we pay Health Now administrators about on average $4,000 a month in admin fees. And those fees are allocated to the departments based on who takes the health insurance. So there's a breakdown when the bill goes over to the treasurer's office to be paid, and then that gets allocated out to the department. Health, Blue Cross Blue Shield, Highmark, they will not charge us next year for our HRA administration. It is built in their rates. So our insurance this year only went up 2.92%. So that did include them taking over the HRA accounts. So with that, it would, I mean, it would roughly save the county about $48,000 a year, right? If it's 4,000. Yeah, so and we did have a WebEx with Highmark about how that's going to look. They have to do the setup for us. We have to do that transition. Janice sat in on that, also the treasurer, because our billing and our invoicing is going to be a little bit different with them also. Currently with Health Now, you need some funding from,
Yeah, we have about 200,000 sitting in an account that they hold on to. And then it just has to be like a cushion when they need that, because we wouldn't need to do that, they would bill us for help.
So then we get billed on a monthly basis, not just for the HRA fees, but for the actual usage out of the HRA. So any claims that are paid out on behalf of the employees, that gets pulled out of a county account. And then Janice balances that at the end. So the good thing about the Highmark, there's no refunding of any of that HRA money. They will just bill it as it's used. So that transition will happen on January 1st. There's administration changes. Are we having another meeting with them? Heimer? They kind of,
We don't have some schedule, but they probably, they're close to making a change.
okay, all right. So, and once I have all of that, I'll send out an email to department heads so they can share it with their staff with the changes. The one change that I do know right now, if you take our insurance, we have a wellness card. And then we have our RX only card for our HRA account. Under Highmark's platform, that's one card. So they will know where to charge that money to based on the vendor code. Like when they swipe the card through the credit card, they will know where to bill that charge to. So right now, that's really the only thing different that I think employees are going to see. They still offer the pay to provider. So I don't know if any of you remember, I think in the past, we didn't have pay to provider. So, and pay to provider means that the claim is billed to Blue Cross Blue Shield. They process that claim, they approve it. It goes electronically over to Health Now, and Health Now issues a paper check to go out to that provider. The same thing will happen with Highmark. So there's nothing that you have to pay upfront and ask for reimbursement on. That same process behind the scenes is still going to help happen. Does anyone have any questions on that? No. So number 2 is to amend the resolution 15-388. That was the resolution that authorized Health Now for to be the administrator of our HRA account. It was an open-ended resolution. There was no end date on it. So this is just provide an end date of March 31st. Of 2023 for the term of the contract. We have to go into March of next year. We have a 90-day roll-off, rollover period. Is that a run-out period? So as claims from 2022 they will still be processed through Health Now. And those will be claims dated through December 31st of this year. So that run out period, and they are not going to charge us for that either.
The administration.
That is correct. So there is no charge for that admin fees for those 3 months in 2022.
Okay, questions on 2? Motion is Rick Davis. Any discussion on this? All in favor?
Aye.
Opposed? That carries. Any discussion on Cobra administration?
So can I go to number 5 instead? I'm waiting for Mr. Burkhart from ProFlex to come in. But so I just wanted to give a quick update on health insurance open enrollment. So that's number 5. If you remember over the last almost year now, I have been talking about using a benefits administration platform called Ease. And it is a database that we are currently using to track our health insurance and our dental enrollment with our employees. It's an online site, it's a cloud-based site. And so we're gonna roll out open enrollment this year and try to go paperless. So I've been working with Kyle on getting that set up. It's taken a little bit of legwork to get everything ready, but hopefully it'll go somewhat smooth. I know it's new, and I know that we'll have a lot of questions probably from. But you'll receive if you're eligible for health insurance, whether you're a 0.6 or you're a full-time employee, If you have a county, a hospital, or even a DSS state email, I've loaded those into the system. So you'll get an email that invites you to these. And you click on a link and you'll walk through the steps of open enrollment. So whether or not you're making a change or not, you still just kind of walk through the steps. And at the end, you electronically sign for it. We've been using this with new hires since July. And it's very user friendly. We really haven't had any issues with it. I always tell people, if you're logged in and, we're here in the office, give us a call. We'll help walk you through it, over the phone, but it is such a great program to use, especially compared to the old database that we were using. I didn't even have access to the old database. Like my computer was so new, it wasn't even compatible with the Access database. So I didn't even have access to it. But and this EASE program is something that that there's no in Kyle because he's our broker. He's the one that got us up and running, and it is so nice to use. So open enrollment is going to be a little different this year, but and then you can go in and make changes to your address and your phone number and all that stuff. We get notifications in our emails, so it's really great, especially on the county, on the government side of the employees. Hospital, they're more likely to come stop and see us, but because everybody on the government side is all located in different buildings, it makes it nice, so then they can just give us a call and we can walk them through everything. So. And hopefully I'll get those emails out. I'm gonna send out an internal email first to explain, so everybody has like a heads up that they're gonna get this email from EASE. And they will get emails from George that say, don't click on this.
Questions outside?
Yeah. So number 4, number 3. Number 3,
Either one.
our over discussion. Okay.
Either one.
Okay, so number 3, they have to go in order. So, Ryan, I'm Tracy, it's nice to meet you. So Ryan Burkhart, he is from Proflex. They currently administer our spending account that we have certain groups within the county. And Kyle and I have been working on looking into COBRA administration. So I do have a proposal. Together, I'm gonna pass you out so everybody has a choice. I have my copy of it.
Hello.
That ain't one of those. So I'm not gonna go like through the whole proposal. I'm gonna give you a little summary of where we are in our thinking with us, my thinking with us. So COBRA administration, COBRA is the federal law that, employees who have, lost, their insurance coverage from either termination or, like a reduction in hours. It could be a spouse, that covered on a family plan that, they could also have it. It could be a dependent, so now your health insurance, you can cover a dependent child up to age 26, when they, you offer them Cobra coverage. So that is what, so Cobra law. And right now, we manage the letters. You have to send out a letter. We manage the letters coming out of our office right now. In 2020, and Cobra law hasn't changed. I think it's an exception. So in 2020, federal government passed the CARES Act during the pandemic. And within that act, you could not terminate a person's Cobra for non-payment. So that means an employer could be carrying their Cobra benefit without payment. That for it was probably, I think, through the end of 2021. Blue Cross Blue Shield used to do our Cobra billing for us. But in 2021, they switched it to directly to us. And with that American Relief Plan, they also, part of that act, they also said that there's a subsidy period now. So if you qualify because you lost your job, or you had a reduction in hours and you lost coverage for any reason other than gross misconduct, we're going to allow the subsidy period. And it was from April 1st to September 30th. So so now we had the billing, and we kind of had to start to scramble to like learn all that I could about what this meant. So if they qualified, the county paid that Cobra bill. And then we recouped the money through our payroll taxes on our 941. So even though Cobra law hasn't changed in a long time, it has changed in like the last 2 years in the administration of it. So I was talking with Kyle, and when we were talking about the changes with the HRA, I wanted Kyle to start looking into Cobra administration for the county. It's not uncommon for employers to not be in compliance with Cobra letters, or even just the administration of the Cobra. So Proflex was one of the companies that Kyle had looked into. And so they had like the best rates for the Cobra administration. So on the last page of that, it will see like what their proposed fees are. So there's no implementation fee. There will be an auto renewal fee of $125. And in the middle, in the black, the monthly administrative fees, the option 2, that is the one that we are looking at. And that would be a qualifying event notice of $25. So that would be any time that an employee resigned for term, or they had, maybe they went from a 0.6 to a per diem and they weren't eligible for insurance, then they could Cobra that. Your dependent, if they're over the age 26, they would Cobra that. So we would notify Proflex of that, and they would send out the letters on our behalf. And because they're experts in it, then we would be assured that that we were compliant with that federal law. And if any changes were to come up in the future, they would also you know, be the administrator of that, and they would follow along with those laws. Those initial notices of $4, so we don't even need to worry about that part because we are able to load that initial notice in that ease program that I was talking about earlier. So anytime we have a new hire, when they log in, they get that initial notice. That initial notice was not even being sent out, and I just like learned that in like the last like maybe 3 or 4 months that that was not being done. So what I did to get an idea of what this would cost is I looked back in our files, in our electronic files, and I did a 5-year look back period as to how many letters that we sent out. And on average, we send 122 letters out. In 2021, we sent out 142 letters. And that was high, that was really high. And I feel like that was definitely an anomaly. Probably because of what was happening at the hospital. Because in years past, we had like 81 letters in 2020, 49 letters in 2022. So I feel like that's like the highest on the average. So I calculated that the cost for having COBRA administration through ProFlex would run the county anywhere from like 3,000 to 5,000 a year, but I really think it's going to be on the low end of 3,000. The fines for COBRA for non-compliance, that is on page 7 of the proposal, and there are fines with the Internal Revenue Service. And it's $100 per day per violation, up to $200 per day per family. And Brian probably like touched on that a little bit more than.
Yeah, it's just needed to be, and I think Tracy nailed it with, in terms of the legislation, into the foreclosure space, I think people were really struggling to keep up. So we appreciate the opportunity to come in and answer your question.
So my proposal is that as of January 1st, that ProFlex would be our administrator for COBRA and allow us, and then, you know, we would know that we were in compliance with that federal law. And I also feel like because legislation had changed like in the last 2 years, that I just feel like maybe it just kind of opened up the, you know, the door for other changes in the future. And I'm not gonna lie, I'm by no means like an expert on COBRA. So I feel doing my due diligence as the administrator for the insurance for the county, that, you know, it would be in the best interest that we have an expert manage our COBRA for us.
We're saving money on the one side, so maybe it makes sense. Because laws keep changing all the time, and if you don't stay up on some of this stuff.
How does actually that COBRA work? Because you have one employee that his wife carries her insurance through Pioneer Credit. Now she's going to lose it, so I'm not going to have to put him on insurance. But will we get a COBRA for a while from that company?
Yeah, so what would happen is she would get a COBRA letter that allows her to pick up their current plan,
But she has to pay for it.
but she has to pay for it out of pocket. So now if he was your employee and if you you offer health insurance to your employees, that's a qualifying event for him. And he could pick up insurance through the town. Yes. And COBRA laws, there's federal COBRA laws, but New York State also has additional mini COBRA laws. So federal allows you to carry that policy for 18 months, but New York State has an additional 18 months, so it's 36 months. So currently, because Blue Cross doesn't do our billing for us anymore, that bill comes to the county. Right now, we have like 3 teachers for Blue Cross. So the county pays that bill. And then, you know, we try to have people pay that, their invoice the month before. But if they don't, like the county, you know, the county pays that money and then the individual pays the county back. With this, ProFlex would be billing the individuals on our behalf. So we wouldn't even have to collect any premiums.
So they'd be billing, and they'd also be paying the,
They will pay yes, the individuals would pay ProFlex because that's where the bill is coming from. Correct?
That is
and
correct.
ProFlex is gonna pay the health insurance.
Right?
So then what happens is, once we bill and collect the premium from the people that are filing for COBRA, what we do is we'll aggregate all of those premiums that we've collected. We will cut one check. It'll be a list bill for every individual that we collected, and we'll remit that back to the county so that you can provide that premium to carry.
So we're still paying,
So you're gonna send us a check, we're gonna still pay.
yeah, the monthly, we're still gonna have to pay the health insurance and then we'll just get reimbursed. So
Which
there's
can be
no.
eliminated from the entire billing process. We'll be collecting all of that, but again, we'll provide you the reporting that goes along with everybody that we collected. And then when you submit your active premium payment, you'll have this premium collected. You'll also know who stopped paying premium, and then we'll provide them lapse notices after a period of time.
So that's the other, I mean, that's the other part of it too, is like the payment and the terming is kind of crazy too, because they have so many days to pay their premium, but if they don't pay it, you can term them, but then when they do pay, you have to go back and reinstate them.
Right.
But like I said, we currently have 3 people that are on COBRA. But I just I feel like the letter part that goes out, that election notice when somebody is eligible for COBRA, because we send it out on dental also. So even if you don't take health insurance for the county and you take dental insurance, dental is also something that is covered under.
And if I may add, one thing in particular that we've noticed through the last couple of years is a lot of organizations do this internally, but they don't have the software that's necessary to run, right? So a lot of it is a manual process. What our system is, it's a national platform, covers all 50 states, as Tracy mentioned. It's federal law, but each individual state has its own nuances related to that. That's all built into the system. In addition to that, what's built into the system is exactly the correspondence timeline that needs to go out to cover the county in terms of the compliance, the notifications, right? If these people do not elect coverage, then they're out. Once they're outside of that election period, they can no longer elect, right? The other piece is a vast majority of people never elect. On average, our book of business is about 95–96% of the people do not exercise the option, and about 4 or 5% will. For those people that do engage COBRA, we will do all the billing and the premium reconciliation and the application of payment. So it creates, because of that software platform, kind of a paper trail in terms of correspondence for those that don't elect it, as well as those people that do, and then who we're collecting premium for. So there's a cover your organization kind of process as it relates to the software itself. If that's helpful.
So if the employee doesn't, the ex-employee doesn't pay their premium, who sits on that money till it does come in? You guys or the county?
County,
The county will leave.
right?
You're saying in terms of somebody electing it, but they don't pay.
Right.
So at that point, what if we don't receive the monthly premium, the school will send out monthly coupons, so these people can remit premium. When we don't receive premium and within the period of the grace period after the due date, immediately generates a lapse notice to that individual that gets sent directly to their house. And they have X amount of days to respond with providing premium. If there is a situation to the letter of the law, you can say, you didn't pay your premium, you're past the lapse period, and therefore your coverage is terminated. If there's some concession that the county wants to make, you go back to the carrier to get them reinstated, that's entirely up to you, but we're gonna manage it for the letter of the law in terms of the timeline these folks have to either pay their premium or elect.
But we're hoping.
And then Blue Cross would give us their credit on the premium going back to the date of termination.
So we would pay it up front and then they would credit it back.
So our annual legal administrative fee is $500. So using today as an example, we have 3. If that's what it is, that's what we pay for the year out, right?
So there's gonna be 2 pieces to that, because of the 3 people that are out currently. If you decide to move with ProFlex, we'll take over those people wherever they are in that 36-month window for COVID. So we'll take those people over, we'll start billing and collecting premium for those 3. Those 3 people, if you see about, I don't know, 5, 6 lines down, it says current continuing conversion. So that would be 3 people times $28 that we would bill you to take those people over. The $25 per qualifying event, that could be somebody's terminated, somebody has a dependent that's aging off, past 26 years old. Any qualifying event that Tracy or her team would input into the system would be $25. That would kind of build up to the point where the annual minimum is satisfied at 500. And once that was, then we'd start billing you $25 per event. Based on the numbers here, we said on the average, Tracy, it was about 100.
Yeah, so I ran our numbers as of October 20 as to like how many letters that we sent out so far this year. And then I went back to 2018 and I looked at all of those numbers. So on average, our total letters sent are 122. So I think we're pretty close to that
Wow.
3,000.
25 bucks. Well, the 3,000 plus.
I think the one piece that you really have to take into account is the head count hours that are associated with someone billing, tracking, postage, and there's multiple postage that goes out through the corresponding period. Especially with the class, and we'll be able to provide at least a set number of correspondence to let them know. But we can add all that up in terms of head count hours as well as, ancillary charges like your postage and some of the other things. I think you find that for a while that the number far exceeds what would be charged to the county for council service.
And a lot of people don't pick up our insurance as Cobra only because it's a high deductible plan. So if they have a family plan, it's $1,700 a month. And even though we can roll over whatever you use under your HRA deductible, so say you termed yesterday and your coverage ends, and you have a family plan and you have used $2,500 out of the deductible that the county has paid to date on you. You are also now responsible to pay the remaining part of your deductible. So not only are you paying $1,700 a month for your premium, you're also responsible for that $2,500 remaining on your premium until the end of this year. Then if you decide to go into next year, you have that full $5,000 deductible that is your responsibility and the $1,700 that you're paying a month for the premium. So a lot of people, you can find less expensive insurance out on the marketplace. is coverage as good as what the county gets? No. But if what you're worried about is what you're paying for your premium, yeah, she can find other insurance. So that's why like we really like the 3 people that we have. It's probably because they met their deductible, so they know they only have that small portion, you know, to pay. And I think they're all single policies too, so.
Are we currently in non-compliance on this? In your thought, did your office fall behind on?
Not on the legs currently, but, you know, and looking at this and then going out onto the Department of Labor, website and then, and talking with Christina, you know, like what, everything are going out, like, then I realized that we weren't, the initial letters, which is when a person is newly added to the plan, they should receive these letters. So, as soon as I realized that, then that's when I talked to Kyle and we had that letter uploaded onto Ease because we've been using the program with new hires since July. So when they go in and they're doing their election, they see that code of notice, it comes up, they have to acknowledge it. They don't read it, but it's acknowledged, so it keeps us in compliance. So that's where like we would save some money with using ProFlex because we don't have to, we won't be paying them that initial. But like there were different letters that were being sent out for dependents that lost coverage as opposed to just using the Department of Labor. They have model notices, so all the language is there, you kind of fill in the blanks and but like those are and like the payment part and the you know, the waiting period and that grace period for payments and everything. We don't have anybody right now that's not, you know, that hasn't paid. And also, like I said, I just feel like this legislation, you know, had changed in the last couple of years. And they don't really give you a whole lot of notice as to, you know, how to go about and administer and make sure that you have, you know, everybody in line. And then the notices from the Department of Labor, the language, those totally changed for those people that were, you know, that qualified for the subsidy.
If I may add to, if anything, what happened with the pandemic was this being exposed in a lot of cases, and Cobra was kind of that. It just kind of lumbered along, didn't change a lot, of minor tweaks to some of the legislation, but I think especially with the Cures Act, the extension with the subsidy and the filing period for people when they could actually elect benefits, I think it exposed a lot of people, and I think most organizations were out of compliance, frankly. And I think that kind of explains the momentum. If it's probably a rapid, most rapid growing business within ProFlex, because again, I think people struggle to find the resource to actually find out exactly how they're supposed to be applying the law. And I think that's kind of speaks to why we're getting over 65 new groups for January 1st. But I think people just said, you know what, it's time to get it off our plate.
Yeah, and I've seen the same thing on my local business, and other groups, including other counties. It's tough to manage and stay on top of it. Them having the software, automating the process, it's just not something employer groups typically have. So that's kind of what I was saying.
Currently have 3 people
Yeah,
as in.
like they're paying our their premiums, yeah. Yeah, so we do billing through Munis, right? We will send them an invoice. But usually they send, you know, they send in a check the month before. We usually get our invoices from Blue Cross Blue Shield about like the 17th of the month for like November 1st. So we get that like 2 weeks at a time. So we tell our the people who are on Cobra that premium should be paid by the 15th of the month prior to coverage. And then they send a check in directly to the treasurer's office.
How many hours a month of administration in the city? You'll need to.
Christine does the letters. And I would say, she maybe like maybe 10 hours, 10, 15 hours a month. Do we do? Yes. And so I'll be in this position for 2 years at the end of this month, really, you know, once in February was I like fully like on my own. So it was just something that because Christine did it, you know, she just continued with the letters that were being sent out. And then when everything changed with the legislature and the law changed and how Cobra administration, so then that kind of, you know, then I was forced into looking at like, you know, what are the letters that we are sending out, and so it's kind of been like a long, you know, a process, and then, you know, I feel like we kind of got through that subsidy period, and, you know, Blue Cross then, as of October 1st of 2021, you know, they pushed the billing or the premium off to the county. So then we started doing the billing with them.
What I just said, let's go with the high end, $15, 15 hours a month times 1,280 times, employee like this with fringe, 32.
Whatever you want.
We're in there. It's $5,700. So if we're talking $3,000 a year is what your estimate is.
Well, currently, 3 employees and 28 hours a month. And correct me if I'm wrong. 3 employees, 28 hours a month, times 12 is $1,008.
The 28 hours.
Well, then I'm almost at
You're kind of 28. I'm okay.
And then we're averaging 122 a year. And $25 qualifying benefit. That's $3,000. Well, we probably $3,000.
Makes sense.
And a current status.
Any motion on that?
Any more questions? Motion to approve the record. Number 4. All in favor?
Aye.
Opposed? Carries.
Well, actually, we got number 4, right? That's what they just. All right. Okay. Stop. Thank you guys so much.
Thank you.
Thank you. So number 6.
Yep, number 6.
Okay. So number 6 is authorize the chairman of the board to sign the 2023 Medicare health insurance rates for retirees. So these are the same plans that we have been offering. It was very stagnant increases. Most of the plans, like the highest increase was like 1.7%. And the Univera high was slightly decreased. So we offered the 2 Univera Medicare, we have Excellus Medicare, and then the 2 MVP Medicare. So these would be our retirees 65 and older.
All single on there. At one time, there's something recommended that you were 2 people and married, but each of you have your own policy.
Yeah, yeah, they're all single, yeah. fees, so.
Cause it goes along with your Medicare, right? It has to be.
Yeah, because you have to have Part B, you have to have Part A and Part B to participate in these plans. And so we do, so like if you retire from the county at age 65 and you have a family plan, then if you wanted to take one of our county plans, you would pick up 2 single plans. You have you would have one and your spouse on the other.
More discussion? All in favor? Opposed? Carries. 7.
Okay, so number 7 is to approve the 2023 workers' compensation cost to the participant. Did I have those lists with you, Cheryl? I'm sorry.
It's attached.
Okay. So, and then the attached list, was approved by the Workers' Compensation Board of Trustees meeting on October 4th of this year, and total budget is $2,634,954. And those would have been the charges to the participants that, you would have reviewed at the Board of Trustees meeting.
Any questions on number 7? Discussion, all in favor?
Aye.
Opposed? Carried. Great.
Number 8, this is a contract with Sound Actuarial Consulting for actuarial services for the workers' comp self-insurance plan. And this is for this current year contract of January 1, 2022 through December 31st, 2022. And their amount is $25,500. This actually is always presented to the executive committee of the Board of Trustees in our fall meeting prior to our annual Board of Trustees meeting. And that is reviewed and they authorize the renewal of it on behalf of the Board of Trustees.
Guess I'm a little confused, because you got number 8 is 22 is 23, and then the next one over there is 20.
For next year,
So we're
yeah,
not doing the 8,
So-
we're just doing 9.
I'm doing both, so I'm getting this caught up for this year. And then because they already have the agreement and it went to the Board of Trustees in October,
We didn't
right?
do it prior.
Yeah, so it's always, so it's confusing, so. What Sound Actuary does for us, they prepare our liabilities at the end of the year, at the beginning of January, and that's based on the prior year. And then they also will prepare our budget for the following year. So for 2022, they prepared our 2021 liabilities. And then they prepared our 2023 budget for workers' comp. So number 8 is for this year's payment for this year's services. And number 9 is for next year's services. So I'm just trying to get ahead of the game.
So this never used to come here.
And our came through
And
committee.
these are the little things we're finding as we're moving through the new process. There's no contract to tie the purchase order to pay them.
So that's what happened, yeah, so they really didn't. I got the invoice from Sound to pay, and I was starting to put it into Munis, and I went, no, I need a purchase order, because it's $25,500, so I put the requisition in, and then Janice had emailed me, she's like, well, where's your contract? and where's your resolution? And I'm like, I went back through everything that was done in the past and I don't see any of that. So then we have that discussion of, well, now we see all of this in newness. So we should still follow, right, that same, so. That's why we have this year's, and then because I have everything ready for next year, except for the invoice, that at least we're ahead of it, yeah.
So the little things that have trickled and been done always the same way, it's like, wait a minute, why would this be any different, so. Yeah.
And we're done 8 or 9. Ready to go, we can act better. Ron, yeah. And we're discussing, all in favor? Opposed? And carries. Anything else? Jason?
I think that's everything. Yeah, I just want to say, if really, if anybody has any questions about like open enrollment and fees and everything, call us and we really want everybody. So I'm excited to offer that to people this year. So yeah. Call us.
So is everyone gonna be going into it?
Yeah,
Even if you've already been,
yeah.
okay,
Yeah, everyone, if you are eligible for insurance, you're, so even if you waive insurance, you do a buyout, right? Because it's open enrollment, you have that opportunity now to make a change. So everybody can log in and you just, if you're not making any changes, just go through the steps of, that you follow along. It's very, very user friendly. And then we'll use it again next year during dental open enrollment. So I really want everybody to kind of get in the habit of using this system and to help us go people less. Okay.
Any questions for Tracy?
Okay. Thank you.
Hey, Bill.
Good.
Yeah, phase 3.
All right.
Yeah.
So the first thing I have is a contract to renew our email encryption for CUW. It's 6. We've had it a few years. We haven't had issues with it. I'm looking at a solution in the future, maybe that would have like an enterprise license, that we could have the whole county protected. Right now, it's just a user by user basis. But that's hopefully maybe by next year before we renew, we can do. But this is just a renewal of the current contract we had for email encryption.
Any questions on this? I have a motion by Supervisor Becker. All in favor?
Aye.
Opposed? Carried. Number 2, FYI.
Yep, this is another contract. This is a renewal of our archiver for an email. So all the email that comes through gets archived by this software. This is something else that might be replaced in the future, but for now, we're keeping it so that we can stay up to date and stay current, so.
Questions on 2? Keep moving, number 3.
So number 3, we were awarded the cybersecurity grant I applied for earlier, the total of $50,000, which is the maximum that they offered. My thought for use of this is that I might try and actually, originally I was going to have this used to have the company that produces our firewall go through and check our rules, and then help us mediate that, and also get some really basic network monitoring tools. But now, after hearing some other things about counties and their cybersecurity issues, I'm more so looking to possibly get our email moved to the cloud, like hosted through Microsoft itself. So that's something I'm working on pricing, and then I also just contacted my grant rep yesterday. And I'm looking to see if that is a feasible expense account, if not, it would be sick with. What I originally planned, but if it's not, it's something that the state's wanting us to do, and after. Learning it from other events and other counties, it's something that I'd really like to do sooner than later. If it's-
With the email being down.
Yeah, it's,
Weirdly,
yeah, so that would be the weird, I guess, not throwing the weird, but up and down should be basically good now. But yes. Thank you.
Okay, any other questions on number 3? Yeah, the motion by Supervisor Becker. All in favor?
Aye.
Opposed? Carries. Top page 4, number 4.
So number 4 is an amendment to fix the dates, I believe, the contract for last committee earlier. The resolution was 22-143. I believe we just had the dates incorrect. Is that right, Cheryl?
yes,
So we're just looking to change the dates of the
Ready to break? All in favor? Opposed? Carried. Number 5.
Number 5 is appropriation for telephone maintenance. Main reason is we're moving departments into the ag center, county departments, and they didn't budget any funds for telephone maintenance because normally we have a different system over there than we do in the rest of the county campuses, because we didn't have almost any county departments over there originally. So every time we do changes, like if we bring in a new department, we have to port their numbers over into that system instead of our system, and they also become, right now, mostly at this complex and DSS, public county, those outlying buildings. Normally we just add a number to our list, and then when the call comes in, we direct it where to go. Over the Ag Center is different because it's not part of our system. So we literally have to transfer the number, we have to call Frontier, transfer the number, it's a big change. So this is cost for our vendor to make those changes for the buildings and grounds and veterans. And even if building codes wants to add more phones, or make change like a big change like that, that's an expense. And now we're gonna maintain all those costs.
Want to do number 6? Whatever.
Yeah. So that's to move. We're moving it to telephone maintenance.
I think she said she only needed 8.
Yeah.
I asked her, what's the deal?
Oh, for the 4.
Did she tell you that? Probably not.
It's on here, we need 1873. There's that we need to right now.
I said to look further into the year.
So I have on here 1873. So maybe that's what we need right now. Why we need 80 cents. So you want to change it?
2000.
Sure. We change that number to 2000.
The 4,000, 2,000?
Yeah. Sorry.
Good. You want to do number 6?
Yep, so number 6 is our internet line, but one of the big driving factors of this year is we had the new fiber connection up to Weathersfield. That's a gigabit connection that we're gonna be pumping backups through Frontier, and so that's a driving factor. We also have a couple of redundant internet connections at some buildings that will be going away, hopefully, throughout the course of next year. So that will lower some of that cost.
Any questions on 5 or 6?
Yes.
No discussion? All in favor? Opposed? Carried. Number 7,
Number 7, we have a couple of assets that we're looking to dispose of. One is the Cisco HVAC, the really old router. That we had, it's outdated and it has been in service for quite a long time. They don't make updates for it anymore. It's really. It's beyond life expectancy, so if we literally haven't used it ourselves, how many years? The second item was a scanner from records. Again, this is also a really old item. Purchase, but it is also not operational anymore. And I don't believe parts are readily available for that either. So we're looking to dispose of both of those items.
any discussion on these? Hearing none, I got a motion by Supervisor Jacoby. All in favor? Opposed? Carries.
There's one more item I wanted to talk about. It's about the 2 vacancies I currently have in my department. One of them was the network administrator position that we brought through last committee to fix the salary. So I just had 2 candidates come through over the past week, one being yesterday, that applied, and both of them are willing to take a salary in that range. Literally both are looking for 55,000. So I've had 2 positions open in the county since I started in this position. The other one is a tech position, and that salary is sitting at $40,000, I believe, right on something. So what I'd like to get approval for is hire both of those network employees. 55, because that would be in the same budget as if I hired a tech at 40 and network admin at 70. And the reason is, with the network admin, they can do higher level work as well as lower level work. They're also able to do the tech work that everyone does. But if I had 2 at the same time, I can train them at the same time. So I'm saving time myself because I'll be the one that trains these individuals when they come in. And then on top of that, we'll have a redundancy. If we lose a person in a year or 2, we're not going a year or 2 without another person in that. And the way it stands now, they both. At that salary, they would both be in my budget amount for the 2 vacant positions I have. So really, it'd be a title change. That I'm requesting. For the second position of the tech.
Well, the tax program that we're getting,
Correct.
You want 2 techs.
I want 2 network guys. Yep. And again, this is the position that when we talked about last week. Or last month, sorry. These are the positions that can take some of the bigger workload, they can take a project and they can. Almost have that project. Hopefully would be the plan, so we can start knocking down some of these tasks that have been there. Longer than I would like, so.
Any feelings on it?
It makes sense. I'll make a motion. For him to get whatever he has to do, change the position, title or whatever.
I'm gonna do. I don't know, we're gonna do 1 block or 2, but it'll be the summer schedule last. And then we're gonna work with Dan and HR to make sure that the paperwork gets like to us immediately.
Yeah.
To make the change from the. Tech, whatever tech position, and we'll get position, like we'll get it right for the resolution, but. Sitting here today, I'm not sure. 100%, right?
You have to set the $1 too for both.
55,000. Yeah.
It fits in his budget that he had, so it makes sense, and we're short.
Yeah.
Most people don't come along every day.
No, and the last 2, like I talked about last time in committee, both of the last applicants, these current 2. I called one 3 days later, she had another position, and I called the other one. A week between interviews, so a week and a half later, and. It's really tough, and then that was a month ago, they hadn't been all sitting applicants until these 2 came across from this. So.
What are we doing, an effective date, like November 8th or?
Yeah, they're gonna have to then do this in their current position, so.
Yes.
We'll do this together, we'll do the letters.
Yeah.
Okay. Hey, does everyone understand? I got a motion by Supervisor King. Two in network.
Network and.
Network and. Hearing no more questions? All in favor? Opposed? Here, is
Thank you.
there anything else you want?
No.
We got any questions for Bill? Really? Bill's starting out one, sales tax. Update your financials.
Yeah, thank you. Breathing, pushing there, That's probably surprise, we're almost.
They hate that.
Until they. It's gonna be less for this round, but I, fingers crossed, I don't think it's gonna be. Zero. In terms of investments, I was able to, about the 3+1, they said they cast out a new split tier savings rate we took advantage of. End of August, so once we got our September, interest statements, we actually went from getting $1,100 in interest in 1 month to $7,200 in interest, so. That was nice. Basically, services. Interest is still going to. That is, I think, 3.2% for our swap now, so. Really good rates.
You want to do that one? You want to do. Page 5.
So a contract for bid by. It's an FYI, we use that for the auction this year, we don't pay them anything because they're, when the auction takes place, but just, formality. It's a 5-year contract, but you can revisit it every year, so.
Question down 2. Number 3, corporation.
Our audit services for Department 1320 were $504 short when we got the invoice from Russia and Milwaukee. So that's what that is. For the 2021 audit.
Any questions on 3? I've got a motion by Supervisor Brick. All in favor?
Aye.
Opposed? Carried. Number 4.
This is the annual resolution to approve the town balances to be included in the 2023 tax bill. And $9,448.04. It was just for. Diesel.
Any questions on number 4? Motion. With the grant. All in favor?
Aye.
Opposed? Carried. Number 5.
It was the annual resolution to re-levy the utilities for the taxes.
Question on 5. Motion by Supervisor Becker. All in favor? Opposed?
For me.
Any questions? Good. Thank you. Yeah, you're up. Well, start with Alan.
They can run, but they can't walk.
Right.
Yeah.
You're gonna get up.
Morning.
All right, we're all set. Good. Working out. On page 5, we're on the general update.
Losses in September, we had been trending down to about 2 million. So forth. Back up over 2 million, part of that's about 200,000. Paid, retro paid. But also the concerning thing, and I think this group needs to be aware of, is the revenue prompts, as Dr. Mason left, just continues to be an anchor on analysis. It shows surgery into orthopedics, it's continues to weigh on the organization. Probably our biggest competitive right now.
Yeah, when the lack of surgical volume is driving revenue down at this point.
So we have, and I'll talk in detail about our improvement. We gotta get surgery back. Station. Make sure most patients. Certainly encouraging. So I've set up meetings with all surgeons and all the primary care physicians, everyone back. The expenses are probably on a good trend long term. As we've noted in our meetings, these are kicking. So we need to do some of this to go back to revenue increases. Biggest thing is just the loss
The general surgery, why it being shipped out?
Well, it's, yeah, I mean, if you look at the trend lines from Mason's departure and go plus and minus, that's when kind of the vibe really started to drop. We lost a number of surgeons, general surgeons, orthopedic surgeons. So, there is a continuing issue of send-outs from our hospital. 40 to 50 to 60 a month are being shipped out from our ER. And this is some of our very clear heart attack, stroke, things that we cannot say to take care of. But then there's a lot of brain areas that doing this for 30 years, I'm very confident we can keep it. And so we're working on that. We're working with the medical staff to change some of our guidelines about consulting physicians, seeing patients in our ER, but that continues to be a significant issue. My understanding is this has been a long-standing issue in Wyoming County, that we ship a lot of patients out, but we've got to reverse some of those trends. I bring this up again. I think I mentioned this probably just several months ago. Our loss rate for Wyoming County is 70%. That means that 70% of our patients achieve about 30%. That number has to go up and any chance of success long term. And part of it, Brian, is exactly that. Shipping many patients out of our ER. So, Dr. Wyoming is well aware of this, Dr. Posse, Dr. Fahey, and I'll be attending every transfer meeting going forward to make sure Dr. Janice talked to. Make sure every one of those patients is scrutinized to make sure that they truly. And it goes without saying, where these patients are going is they're going, the majority of them are going. PCMs.
Question, just talking a little bit more about the, diversion.
Yeah. So we went on diversion, I think some of you know, on Saturday, we continued through, most of Sunday. And the reason for that was we were, full. And what that means in a hospital setting is the inpatient side, we had approximately 30 patients with 4 nurses, is I'm understanding, I may have that incorrect, but that's what our nursing staff informed me. Which when you look at those ratios, once you go to about 5 to 1, RN per patient, 6 to 1 to 7 to 1, 8 to 1, it becomes unsafe. And so at a certain point, we had to stop with our admissions until those patients could be discharged. And the ER was also full. We had 8 or 9 boarders in the ER. We just couldn't take any more and still provide safe care. So once that we transitioned, we were able to discharge some patients, get some folks out of here.
Is there no scope out?
Like I said, I didn't get it. I wondered how it was that.
No, we do not.
Really?
You didn't get it? No.
We didn't get one.
So yeah, it's to.
Come out right by yourself.
I was informed.
I got it.
So do you, it's a long-standing thing that we send people out. What did you call that?
Yeah.
Transfer. So if that culture doesn't change.
We don't.
What's the impact? With it, so if that's the big, piece, that reduction in. Yeah, what does that number look like? What are we talking about? Like, if that's been a long-standing, what did you think? Long-standing issue or culture or practice of that, of the hospital. Obviously, it can change quickly, but what is that drop in revenue so much? How are we going to manage that? If it doesn't change as much, I mean, you know what I'm saying?
Yeah, we're not managed, it's not possible to manage that much outflow out of the county, we have to reverse that. That's the game plan, for us, is to reverse that. Have more patients that come to our treatment area, have to be comfortable, admit those folks to have consulting physicians come in person. Right now, our rules with our medical staff is if you're in Buffalo or Rochester or somewhere else, and you're consulted on a physician on a mission in the ER, you don't have to come in. You can just call and say, oh, that's too complicated, ship that patient out. And at the least resistance, I've never worked in an organization that has it. Every place I've ever been, you got to come into the ER, get in your car, come into our ER and look at the patient, set eyes on the patient in person. I've never heard that. But we allow it to go on. And this is why I think we have a lot of folks being shipped out. So to answer your question, it's not sustainable. It has to get reversed. So our hospital group has to be comfortable taking a little bit more complex patients. We have a full array of services. We have a full ICU, we have good nursing staff, we have specialists, we have cardiology, we have neurology. There's no reason we can't be getting a lot more patients here. That's what we do. Phoenix, we're paying a lot of money, millions of dollars per call right now. So it's gotta change. We gotta have folks. Dr. Byron has been very receptive to this. I said, we gotta change this where the medical staff requires. We got privileges at County Hospital. You have to come in your consulting position. You have to come in person, see the patient in the ER before recommending a transfer.
That makes
I think
sense.
that's the least we can ask of folks in exchange for paying a lot of money.
How many of the physicians live in county?
I don't have that number off the top of my head, but the number of them do. What do you if they don't, Brian? If they're on call, they have an obligation to treat our patients, our residents in Wyoming County.
Service.
Kind of burns me up that they're just calling in from Buffalo or Rochester or somewhere else saying shut it out. And they've never seen the patient before. I wouldn't want to be treated that way. I can do RDR. Again, it's an unusual standard, but again, I'm strongly recommending our medical staff leadership, and Dr. Valley has been receptive to this. Changing that meeting.
Makes sense. You're being under, yeah, oh, do this. They should.
So representative of. Over with you are.
Well, you know, years ago, we had a discussion about fighting every accident victim to Rochester, Buffalo.
Right.
And this followed along with that. Because we're sending all the business out. You know, and we had Dr. Collins here, and he was very concerned about being able to treat a trauma patient here at the hospital, and that's why he had, you guys have been on in the departments, you know what this whole thing was about. Because every time there was an accident, we're calling for Mercy flight, or we loaded them in the ambulance and took them to South Buffalo Mercy or Strong. Am I right or wrong? Same thing. And I think the problem is somebody wants to take responsibility for this. Am I right or wrong? I mean, if I'm wrong, tell me right now.
No, you're 100% correct, because I had the same issue. Because when the patient almost beat you home from the hospital, and you have an issue.
I'm not.
They're moving it now.
Not all saying anybody's right or wrong. I'm just saying that's the way it is. And now we're looking at a $20 million deficit. He's trying to figure out what the problems are. Here's one of the problems. And if you'll recall, I think, I don't know what the number is, but when a patient is admitted to the hospital, the insurance pays like $7,000, something like that. Correct. That's for 3 days. If they stay 10, it's still $7,000. You don't get any more for it. And that's what he's talking about is patients, and I know this because I have a friend of mine who was in another hospital, very ill, 3 days. He's in rehab in a nursing facility someplace. So other hospitals don't do this. We're doing it. And when you start talking patient after patient, what do you say, had 30 patients in there? If half of them have been there 4 or 5 days, we're not being paid for it.
More money.
And we're paying the expenses. We're not being paid for it, the nursing and the tech and all that.
That's the reason why. We've got to get more efficient in discharging our patients. And some of you may know, we have restructured our case management function, which is known as that's who determines the status of the patient, new patient, their intubation, how long they should be here, and what their discharge is. And this is, having worked on the for-profit side for a number of years, this is something they do very efficiently, because this is where the money is. We're going to get $7,000 for that patient, whether they stay 2 days or 50 days. But there's something known as a geometric mean length of stay for all the DRGs, diagnosis groups for the patients. That's pneumonia, you know, just a heart failure, hip replacement, and so forth. Target that geometric mean length of stay, whether it's 3, 4, 5, or 6 days, and that's your target date to send the patient home with appropriate care, home care, rehab, outpatient rehab, all those kind of things. It's a work in progress. Mark can talk about this a little bit because he's really helping to lead this up for us, but that's why we're.
And when this hospital is full, we've got 50 people who we aren't being reimbursed for. The rescue calls don't stop.
Right.
So when we can't bring them here, we're missing out on $7,000. Doesn't make any difference whether they stay a day or 2 days, but after 3 days, there's no more 7,000. So all the calls that were not able to be brought here over those 2 or 3 days, we lost that money. That's revenue. It can't go on. It's unsustainable.
Sure. You know, we start with a statement. So as Dave mentioned, volume wise, the mental health and skilled nursing still continues to be powerful. Our acute census continues to be higher than what it was a year ago. Big issue has been the fall off in outpatient services, in particular surgery. The month of September, when we pulled the PI business out and sort of segregated it off to the side, we only ended up doing 48 total surgeries. Only 3 inpatient surgeries and 45 outpatient surgeries. That was about a 30% drop from the month before. That time started delving more into ER transfers, all the issues around general surgery, because there are size hospital volumes. We could have a very active general surgery program. When I say general surgery, 9 a month, 9 or 10. So it was a very low month for general surgery. Sort of a spin-off of that, we're still seeing imaging, lab, and rehab services down anywhere compared to last year, 20%. A lot of those, again, are services that surgery sort of help drive. Ordering scans, ordering rehab. So that's been a big reason why we've seen a drop in revenue. And then our clinic total by themselves, they had been running for the first, I'll say, 7 months of the year, fairly close to last year. They're off 33% in September compared to budget. They've now driven, so if you look at the year-to-date basis, we're down 6%. So we've seen a big drop off.
If I could just note, that really is predominantly Arcade and that practice there. Dr. Dean did retire in July. But practice model in Arcade versus our other practices are Arcade is a capitated model. You know what that is? They're paid per member per month for their panel, which is about, I think, 7,000 patients or thereabouts. But they're basically paid to keep people out of the hospital. All of our other clinics are basically fee for service model. The more patients they see, the more they, and there's no penalty for having folks come to the hospital. Was anybody aware of that? Anybody aware that that model in Arcade is very, very different than it is? It's difficult to integrate that model into our other models because it's so different. And all the payers that are contracted with Arcade, Dr. Dean's model, he's been very effective at it. He was for 35 years, but it's just a very, very different model. Their incentive is not to send people to the hospital, out of the hospital. And insurance companies will pay them a higher rate, but it doesn't help us when we're struggling to do more surgeries.
Dave, I know that a few years ago, and, you know, time goes fast, maybe 4 or 5 years ago. You know, when we was talking about, you know, the purchasing the deed practice. I knew that there was a movement to pay providers not to hospitalize patients. I don't recall whether it was specific to the deed practice or not, but I recall hearing that. But at the time, I don't think the county owned deeds practice, so it was a whole different ballgame, you know. Since he's retired, now it's all changed.
It has, and it's accelerated. Yeah. And Blue Cross and Independent Health and other payers in Western New York region are very happy. This is their model because they make more money when people are not in the hospital. And that's fine. What our strategy is at this point is to separate arcade from the rest of it. Stand up its own. It's got to be profitable, or we'll have to talk about other options. But it can not. Don't float on its own. We wanted to make a profit. The other practices will continue to integrate with the hospital and look at them on a fee for service basis. That's our strategy.
Now, our Page more apt to send their people who are more apt to go to Springville or Buffalo when you live over that way than they are to come here.
Well, yes, and that's a long-standing issue. Dr. Dean is very comfortable with that. And I think the residents there, you know, in that portion of our county, and some of those referral trends are entrenched. That's going to be a struggle to change some of those. But we are attempting when folks do need care. We're trying to change those. We're also attempting to put services more closer to our PA. We have services, potentially some X-ray services right there to capture those. Dr. Dean was hiring his own imaging company to come in and shoot images as recent as last spring. So we've since terminated with agreements. So we're using our X-ray and not an outside.
So Dave, what's the plan then for our aid as far as that idea of paying not hospital people? I mean, obviously these are the carriers that we're dealing with. To have a discussion with them about.
We have, and I think as we've noted, we've included negotiations on the hospital side. So on the clinic side, we still need to look at that. Soon, but in a very basic way of speaking, Arcade's got to float on its own. It's got to be profitable, and we'll have to live with that model, you know, as long as they're profitable.
Well, I know that the dean has told me many times that he was profitable. However, he didn't have the same expense that once the county bought that practice, you inherited the employees and the expense that goes with that.
Yeah, so Dr. Brewer, Dean Brewer, there's a lot of deans at the LG and Dean Brewer. He is he's the clinic director for Arcade. He's very smart. Some of you may know him. Smart young fellow, and he is he's our lead. Since Dale Dean has departed, Dr. Brewer is number 1%. So he's a winner. And he has a lot of ideas and plans to make them profitable and grow the practice. But they're
you know, quite frankly, you know, you talk Arcade, but it isn't just Arcade. You're talking the Tri-County area, which is Cattaraugus, Erie, and even part of Allegheny County. They all talk that corner of Wyoming County. So I know when the discussion was being held about, you know, purchasing that practice and the Odell Center, that was defensive to keep others out, but it was also to attract that portion of the business that was available.
Yeah, I'm not prepared to say it wasn't a good strategy to retain that. it's just gotta be profitable on its own. Hospital can't support or subsidize that grant. It's gotta be, it's gotta be, it's gotta be profitable. So that's. And currently it's not profitable and it's getting paid a better rate. Well, we did share with shared with the board managers, and some of the supervisors, there's a one-page, snapshot of all of the clinics and, also, even by specialty clinics. And the clinics overall are producing about 7 million and 7 million and losing about 5 or 6 million. That's a big number. Got the biggest outliers are OB, which has done a deep dive into that, and our specialty clinics, which includes a lot of the call pay that we're paying. It's over $1 million in call pay for orthopedics and general surgery. Some of the other specialties.
OB ortho. Okay, so with all that said, total revenue for the month was like 4.8 million, which is 1.4 million less than what had been budgeted. It's actually $1 million less than over a year ago. Actual numbers. Expense wise, we came in just under 7 million. As Dave noted, almost 200,000 of that was due to these pay and benefits associated with a late settlement of one of the bargaining units. I think it was E, Schedule E. Employees got their actual pay in this month. If you had taken that out, we would have actually been below budget for expenses. The agency staff costs and costs that we've been talking about peaked back in March at 872,000, continues to go down. We're only 247,000 for the month of September.
I'm sorry, can I just note something? And this goes back to the diversion, Becky. We could open more beds. We could go from capacity of maybe 30 to 35, but it would all be agency costs. And so not to, because we're going to lose our shirts at 2 months.
So the operating loss ended up being 2.2 million after non-operating revenue lost 1.9. So year to date, that brings our operating loss to just under 19 million after non-operating revenue. And Dave had mentioned OB. We did do an analysis of the OB departments. If you take maternity, the clinics, the extra anesthesia costs for spending, and netted against what we're making so money off of GYN surgeries. Annualized, we're at about 2.7 loss for the program based on the first 9 months.
That's what it is.
177 is what we want that to was.
Well, this was presented at the board of managers meeting Tuesday. We went into a deeper conversation about the maternity grant that we had here. One of the things that we've done is to secure outside consulting to come in and look at our program, safety, and also strategic standpoint. What should we be doing? Program, continue the program. We've been talking to children. They referred us to consultants. There was a gentleman. The pediatrician gynecologist in Arizona. Extensive experience in rural healthcare, rural obstetrics. And so he is going to be starting his work next week. And we'll have a report optimistically by the end of this month, end of November. And may not be in time for the that work board meeting. I will try to get it and try to do that if we can. If not, anything on finance? Couple of other updates. Contract negotiations, you may have heard that we're looking at all the contracts, obviously, that the hospital has, that includes our contract, all support contracts, our contracts with dietary, our contracts with facilities, everything. It's a lot, but it's incumbent, given the state we're in, financial standpoint, when we look at everything. We may continue with current arrangements, but we will look at everything. That's our intent. It's got some folks a little nervous, a little bit concerned, and that's inevitable. But it's incumbent, and I just want this group to know we would be derelict if we didn't do that and didn't look at every contract. Scrutinize those, make sure that we're the county taxpayers in this county are getting what they're getting. So that's our intent. Yeah, we'll be very transparent with all of our assessments and bring it to the hospital board. Any questions or concerns? So, the ED hospital is, I'm sorry, the ED contract has been extended for a year, and that approval. So that one, we are still looking at the hospital's group, we're negotiating with Dr. Ione, but we're also. Let's see, recruiting, a lot of stuff on the recruiting side. We had 2 general surgeons in for interviews Friday, young couple, married couple, both out of residency, 2 years, 3 years, relatively young, but they left the role, they worked in Portland for a little while, and now they're the wife is from Elma. It's from Elma. They have a house. And they have a house in Orchard Park. They want to settle down here in Western York. They're Bills fans. I think they're all pretty avid Bills fans. So even though it's from here. So good interviews with them both. We kind of put them to the ringer. That's what you do with a physician. Yeah, tour, talk about docs, surgeons, and anesthesia, and all that kind of stuff. So it's a busy day with it. Yeah, had lunch and all that. Because very strong feedback from the medical staff. And so we're cautiously optimistic. One surgeons. Done offer PA. I don't know. I haven't been heard back yet. Back and forth with this individual for, I don't know, 2 months, something like that. But still optimistic that she will join us here. Start a pain management position, what's known as a podiatrist. This gentleman is Long Street in the Rochester market to do interventional pain, probably twice a month here in Wyoming County. We don't have anybody in Wyoming County at this point in the college. That's interventional. It's not narcotics. It's injections, basically, for chronic back pain. He's all those guys. Yeah. I don't think we have everybody in the county. So a long list of people we didn't count. So our optimistic. Dr. Gomez, the cardiologist, has resigned from general physicians, PC. Joe Gomez, good guy. So he's a free agent, and it's our intent to hire him. So we retain cardiologists. He's the only cardiologist. It's contract with Gomez, who likes Wyoming County, who loves the hospital, who likes the environment, who's staying here. But if we don't hire him, and that will be, I think as everybody knows, Dr. Old has resigned. Her last day will be December 31st. So we're in negotiations with Dr. now to extend his contract and pay the management fee to provide 365 program. My understanding is this was a model that was utilized before we hired Dr. Holm for some period of time with Dr. Black and his staff and secured other OPs. That's our plan. Questions? Comments? Marketing, we're working on website ads, billboards, digital ads, Facebook ads, Instagram ads. Lots of different stuff to promote programs and services. That will continue. So I know that that's marketing. So we gotta keep kind of reminding. I know that was a lot. We just got anything I can answer. No questions, we'll move right on to the agenda. Okay, number 2, amend resolution, words contracts for bath renovation project. That's an extension of that contract with builders. General trades and section. This is the PA that I was noting. We did adjust the offer to the individual 25,000 to 27,000. With experience, number 4, many resolutions of the provisions. This is the extension of the Wyoming's hospital school. The original termination was December 31st. This 2-month extension is so we can continue to negotiate. Number 5, and then the resolution. Extension. Correct. It would terminate. Then resolution will be opened. Position. So Dr. Sproul, if you recall, was hired as a long time covering Dr. Mason last earlier this year. He was with us on a monthly basis through September 30th. We've since hired him part-time, which 2 weeks on, 2 weeks off, as of October 1st. So it closes out as the early returns on Dr. Sproul have been very positive. His clinic volume total is up to 20 patients a day now, and he's got surgeries booked out. Yeah, I met Dr. Sproul. I would encourage you to get the chance. He's a nice guy, very talented surgeon. Number 7, professional service contract. This is assured imaging purchase mammography unit for $285,000. Our existing mammography unit like does not do three. And that's the current standard. You want to offer, our service, basically, to be able to do that, you can. Number 8, professional service contract, cross-country healthcare services. We are still using, Mark noted, a significant decline in agency expense from about $800,000 to about $2 million. We are still using some agency for critical night shift position. Only unit of staff, half of the only unit of staff for the agency nurses. Part of it is and there's some ongoing positions that are. Yeah. It's a EMR, electronic medical record. Based and rehab is a can be a very profitable service on the patient side. So this will allow them to expand their service. Services. 10. This is the professional services contract. And yeah, this is psychiatrist doing. Number 11, professional services contract. This is technology, software, equipment, necessary operational radiology service. So as we know, St. Lawrence, Dr. Mesko's group has been terminated in the hospital. They will be departing in January. The new group, Niagara Frontier Radiology Affiliates, is Dr. Rick and Dr. Lesh. They will be taking over coverage in the hospital. This is probably the Catholic health system. The hospital, they will, we are in medical staff is very, very easy. Aaron, Dr. Charles Black, used to work here. Let's see. No, the cell protein. And cell schedule C as follows. Our supervisor is still nursing facility to do that. $240 for 4 hour shifts. This is the that's to get hard, difficult shifts to get staff to take those shifts for holiday attempt shifts. So abolish one FTE program director, adult daycare, abolish one quality assurance specialist pension position. When we say abolish, a lot of these are related to what Dan is I found the team at the hospital. Right sizing, also restructuring. So there's still some use that meeting. I think Dan, the open position when we started was about 140, 150. It's down to 87. So we really leave that out. And as Dan has pointed out in the past, if we weren't to do that, given our bargaining unit rules, any of the staff that are affected by job restructures can go think what you use is the back door. And take another position, in the hospital when you have to do it. So that would come. Basically, hybrid. It's- Education, so that was not very bad. And then 14, and so schedule for position. This is PA.
Okay, is there any questions on 2 through 14? Done. All in favor?
Aye.
Opposed? Carried. Right.
Section 50. Number.
So on the bottom of page 9, reappointment. Long County Community Hospital Board member, board managers, Rich Cosmo, for 5-year term. Any discussion on this? Be it quiet.
Sure, I'll probably vote no. I'd like this to be non-consent, so the whole board gets to vote on it.
Okay. Any other comments? Questions? Is there a motion? Sure. Raise your record. No more discussion on it? All in favor? Opposed?
No.
Roach and Rick. That's it. Great. There is. For anything else? We're good, lots of money on the front, but there's a lot. But there's a lot, you know, it's just so different, but there's a whole lot. There's a lot. And there's some- You know, to get it straightened out. So. That's what it's at. Got to be subsidizing the hospital. So, I think, Becky, I don't know, Sarah, I met with State Senator George Bello a couple weeks ago, I had a conversation with him. There were several hours, had tours, first time, had a tour of the place. Brian and Mitch, senior team, might help. Good conversation. Now. So, I will be reaching out to a higher. And it's the guy's name, Robert Utri, the CSEA. Regional Vice President. We had, although we had a good relationship with the CSEA, we really needed them on board. Response. So trying to partner. In earlier in office, my intentions, I
was think so.
Counterproductive. That's why I go to the doctor's office and door for the month, and that way I don't ever end up in the hospital.
But that's, yeah, and that's the ideal, I think, for anybody, I mean, nobody wants to come to the hospital. But, you know, sometimes their knee wears out, or get pneumonia, or a car accident, those kind of things. The model that this capitation model, it's called a mixed capitation model. I'll go further, however, if you have a knee, might need surgery, the point is for you to go to rehab, potentially get some pain blocks or something, surgery. The point is it's further down. But they really want to keep you out of the hospital. They do nighttime triage, where instead of going to the therapy, they'll answer the phone. It's a very different model than any of our other lines. Not any kind of suit. Their contracts are wired. These are multi-year contracts. And their whole practice model is configured around capitation. Yeah. This is a model that's been in vogue on the West Coast. Kaiser's used this model. Other entities on the East Coast, it's pretty rare. There's only probably less than 5%. I think payer side of the district.
Yeah, I mean, this sort of is an offshoot of what was the district program, is where district was trying to push things, so. Yeah, Highmark is a big pusher of the simplification. But it is still a minority.
What was the counter?
Like I said, it probably goes back to the, it's really where the district process is pushing things, so that was probably 7 years ago was the onset of district, but we're really starting before we do.
Good. Thank you. Thank you. Great. We have top of page 10. There we go. No problem.
Morning.
Hustle, I mean, it's the garbage. Doing garbage update, guys. So with the upcoming numbers, I have to give to Candace and the department that we do with waste management. We processed all the garbage requests that have been coming in since May. And ended up being hundreds of requests, and it was about $24,000 of omitted garbage fees. People are currently receiving service that we're not going to. That's a pretty big number. So that was a really big lift. We worked with planning, and my secretary Megan did all of the omitted amounts for me, and then I did them all up. So it was a big push, but hopefully that won't happen by next year. Now people successful, but if you do have maybe that's asking about the fees that are on their tax bills about garbage, send them my way. We have signed request forms from every owner that has asked for that additional service. To start being in the program. So thanks for planning to sign my way. We're reminding them what requests they put out. So that was the garbage update. Your final value letters and exemption reports are in your mailboxes. So that's to be attached to your budgets. So those have all been completed and placed in your mailboxes today. So those up. Sandy, you do have that on the same district stuff, but everyone else is ready to go. So while I was out, I did miss the county director association for New York State got together, and unfortunately I wasn't there to accept the award, but I have completed my certification, so I am state certified as county real property director now. So I have that. Adventure renewal forms were sent out. So if you get calls, again, send them to your assessor. Many of the assessors from our office has, and Tina has, and many of the other stuff for this time of year. Last year, they may not have had to fill them out because of COVID. They used some of the information that was necessary to grant the exemptions. That may have changed for this year, so they may be confused, so just send them along to your assessor.
The fire districts, we have slowly but surely been trying to get legal descriptions from fire districts in the county. I will be attending the town of Sherman meeting tonight, with Joanna. We're basically going through and lining up who we're pulling versus the last legal description that we have versus who's servicing. Trying to figure out who's supposed to be paying for the services. And then once that takes place, then the town can go through and re-certify the districts. Imagine then we'll difficult to find the legal description, and there's a lot of back and forth and who's responding or who should be responding. So we're going to do that slowly, one time at a time. We're also addressing now all the county addressing. So there has been a big issue with addressing for about 20 years now. It used to be done by the towns, and then highway took over. And there's paper books that we use for addressing. Unfortunately, when they write down the addresses, it's by owner name. When they sell the property, that's not the owner anymore. You don't know whose address that is. So it doesn't correlate to the tax ID number. So we have erroneous addresses in our system. So you can imagine when emergency services tries to respond, that can be an issue. There are addresses that don't go in order on a street. So again, if the ambulance is going down the street, if you go 1, 2, 5, 3, they're going to be confused on where they're going. It's a long process to try to clean this up. We started addressing following the smallest town to see how long it would take to convert. Took Joanna a couple of days to convert the paper book to an Excel spreadsheet, and then we have to go through every single one of those, discuss where the errors are, and try to fix them. There are places with 2 houses with addresses on a property, we only have 1 in the system. So if you call for an ambulance and say I live at 123 Elm Street, we only have 125. There is no 123. So they don't know where to go. So we're adding those back in. But as you can imagine, some owners are going to be resistant, especially if it's out of order. They've been receiving their mail at this address. They have all of their credit cards go to this address. So it's not going to be an easy process. It has taken Livingston County years to fix this, but they finally did because someone died, because they did not find where they lived. So it's important. It's a big haul. We are going to have Brittany and planning start with some of the conversions to get from these paper books and highway to being digital. From there, we have Joanna updating all the GIS and then getting that over to emergency services. So we set up an entire new system for addressing where it hits all the different departments. We brought our IT, making sure our documents, we can go through all the steps. So moving forward is corrected. Now we just have to go back in time and correct everything. So if there's addresses that come up to your towns, when there's addresses that come up to your town, we'll discuss them with you and the owners and see what we can do to ease the situation. We've found so far, people are actually open to it. Is to say, I can never get my Amazon packages because they're not coming up when they put it in their GPS. So far it's been positive, but I'm sure there's going to be some that don't want to change.
Places where the north side of the road are odd numbers, south side is even numbers. Somebody on the north side had an even number. It just, one of the school buses that I had and tracing around and trying to find these, it's a mess.
We're gonna take it. Lastly, the GIS training. Mike has completed his training for our pro. Joanna also completed her training for our pro. She will be starting the conversion that I spoke about last year. Starting this week, the week after. It's gonna take about 3 to 4 weeks, and then we'll be updated in our GIS system. That's been the longest one. That was in this day.
Is there any questions for Sarah?
No question. Sarah, mentioned on the garbage update. What is it that the road property be done as going forward? Like, you get the notice that.
Yeah.
You get a notice that the house is sold, because it's sold, so going forward.
So it's not so much sold, there's a couple of things that happen. Either they didn't get a bin, and all of a sudden they realize they're not in the program. So they call the garbage number, which is planning. And we knew this was gonna be a lot of requests at once. So myself, Megan, and Jim Briggs sat down and said, we need some kind of a form to keep track of this. We took our split merge request, actually, and we changed it to be one of these forms. So it starts off in planning every time, he keeps log and then the initial comments that come in. After that, it gets sent over to my office through interoffice. I do an initial check on eligibility based on what LU passed on the eligibility document. From there, if I think it's okay, Megan then calculates what the omitted tax would be. I then go in the system and add the unit and the omitted tax. From there, it goes to the assessor for final eligibility sign off. And then we pull in the board of assessor to sign off of that on the end of the year. And that's how that then goes on there.
And this is if somebody wants an extra coat, it goes through the same.
Yeah, any garbage request for a change, whether they want to be added, deleted, extra tote, anything like that goes through the same chain. The only exception is when the CFO is issued on a property, which is only a handful of times a year. We go through, Megan actually went through and looked through all the CFOs to see who we should add. Or CFOs, and then we just do that from the data CFO, you know, assuming they're in eligibility category.
When you get that information out, the report that Robert puts out.
So they used to be involved in garbage, but they're not anymore. It used to go through Bobby a few years ago. She would, when there was a new person that wanted to be added, she would build them out. And then when they had to create like receivable and treasurer's department, and they have came in a non-account, so we completely cut them out of the equation. So it's just planning the real property and you come on and submit a tax, make it easier.
And what's what we were doing last week with the zoning, he was building us for real property. To know the towns.
For psychological. And real property service.
See it?
Service reporting, it said 24 hours.
You got that chart that it is
Yeah.
for his building, why he's building the towns. That aren't part of the zoning program.
Does he supply you with a report of completed building projects? So you can go and do your reassessment or your adjustment on the property?
So the typical way, when I was an assessor, I remember how the way to do it.
But how do, I don't care about that. How do you do it in Wyoming County?
Well, he provides like an Excel, but that doesn't give us much information. So it's basically just an alert. And actually, I need to talk to him because the assessors have come to me and said they don't want that report. They want paper copies of the permits because the report has, let's say you wanted to build a new house in a floor. So you call Roach Construction, right? Because he's gonna build your house and your pole barn for you, okay? They go to zoning, they take out a permit, Mike Roach takes out the permit, so I'm gonna handle everything. Mike Roach is on the permit. Mike Roach doesn't own a property on Smith Street, no address. You do. So when we look it up in our system, can't find it because he doesn't own that property. So the assessor then waits a couple of weeks, gets in their car, drives out, shows the road and says, okay, this is where they're doing construction. They look at the parcel ID, which is what we use, and say, okay, we'll add the inventory to that. Let's say originally you wanted the 20 by 40 pole barn, and then he said, you know, that's really expensive to do. You say, okay, I'm gonna do 20 by 20. They don't update the spreadsheet. So the assessor has to get out and measure, take photos. New York State requires somebody at least to drive by when they add it. So we do get a list, but the permit itself would be more helpful. So like in Covington, the clerk gets a permit and then we'll mail them back to our office so that we get more details. So that report isn't really that helpful. It gives us like an initial alert, something's happening, but not anything detailed enough that would be like on our permit itself.
So with that being said, then how would you know that a building was even erected?
Right, so if we got a paper permit or a scanned permit, then we take those, we would log them, and we already send them out to all the assessors from our office. Right now, we're on the Excel spreadsheet, I think they used to get paper permits and they changed to the Excel spreadsheet, but now the assessors would like the paper back. But that would only be, for the zoning that's outside of the county, we get them from like Bob Martin will send us permits, paper permits to my Graves. So that's how it's handled with the outside zoning permits.
So for you, actually, rather than the paperwork that he provides, you would rather have him make you a copy of the permit and submit you the copy?
Yes.
Is that information been passed on to him?
It was mentioned before, but I will bring it up to him again. And see if we can switch that. Hopefully it would be easier on them.
I'm just looking-
They're not having to run a report, you know, they just make the extra copy of their scan. I don't know what their system is, if they're already scanning. They can just email it over, or if it's easier for them to make a copy and interrupt them, so we're willing to go over and pick them up.
I'm just thinking, just rectify it so it's easier for both ends. So the work that he's spending his time on is benefiting you, so you don't have to go out and double do the work.
No matter what, assessors have to do their job separately. So for instance, if buildings and code set up an appointment, assessor can't tag along unless they specifically get permission, because they can't just show up at someone's house. And they have to take, there's no, at least we drive by from the road and take a photo in order to add it to the inventory. And I don't know if zoning can take photos or anything like that. So either way, the assessor has to go out. The more detailed information, the better, and that's all in the permit already. So instead of having to run a separate report, just do an extra copy once they're away. And then we will look for that tax ID in my office to make it easier on the assessor, so that they would know the exact location.
So you said when this occurred, she said, this is. Was it in the county program?
Correct. So we have a shared drive with the assessors, that's how they log on to the purpose system. And so we go and we take that spreadsheet, we'll tie it up, which would be whose town is, whose, and then we'll provide that spreadsheet. Well, the assessors, we have to go in and do that when we do get scanned versions of, there's only certain things we get the actual permits of. When we do, we divide them up by assessor, and we put them out for.
Any other questions there? Brian? Move on down to page 10. Budget office. $123 equalization table.
Yep, all this stuff was attached.
Questions on number one? All in favor? Opposed? Carried. And number two, a resolution needed to set a public hearing. Tuesday, November 29th at 12:30 a.m.
Anyone, let's see if anyone.
Guarantee we have a very low turnout. I'm assuming PM. 12:30 p.m. There any questions?
Oh,
Yeah.
because I had it, she's asking for her to do that, because I had it 11 a.m. And you changed it to 12:30.
I did, because it was for services.
Yeah. And like,
There,
I'll be away.
you want to move that?
does that work for everybody?
Well, the rest of you are here.
That's the base, you would think.
Yeah, it's after Thanksgiving.
Okay. Then we'll motion. Supervisor Jacoby. Any more discussion? All in favor?
Right, okay.
Carried. And introduce local law that override tax cap.
Couldn't get under it this year. Last year we were under it by just about $500,000, which actually plays into the calculation and I still couldn't get under it, but
I would,
We have motion by Supervisor Bragg.
and if you take a look at this, there's a history thing. And I try to keep the dates on there for all the years of just to kind of remind y'all what's going on that year to make us know, help us out here. Obviously, the hospital is a sure. Yeah, so. Just like to keep track of that, just so to remind us what's going on. Yeah.
2023, when you over under the cap, you got 271. That's not correct. Bottom line. Over 1.2. You got 270.
200 million?
Really old. No, 100% true.
Well, we're 1.1 million.
1.8.
I'll redo it. Doing it quickly yesterday.
No, that's all right, so we're 1.1 million over the cap right now.
That's on the calculation spreadsheet or the mystery spreadsheet. On the calc. This is the spreadsheet. Correct.
Approval. Overriding the break.
And set up a public hearing. Which will be the same day as the
It is the.
budget stuff. Yeah, we're not gonna adopt the levy at 303. It's 30 million.
That was. Great. So, we have a motion by Supervisor Brennan on the floor, any more discussion? All in favor?
Aye.
Opposed? That carries. And number 4, resolution approved recycling levies. Next bill. What's the question? All in favor?
Aye.
Went on to the page, start page 11, number 5, FYI.
Yeah, just an idea of the change we made after we met. Big change, increase the EMS for ambulance service, like we discussed, 200,000, 1,800 I had in for traffic safety board, they never sent me anything, but. That's what's going on with them, I think we should put something in there because they're in the board. 100,000 for county administrator, 53,000 for some cybersecurity that was mentioned. Oh, that is for cybersecurity insurance. 100 for which both these things I received after. The cleaning, I think the open bids are not awarded, but I just added some money to some departments. Instead of having to do it later. Decrease the arts council 10,000 as requested during that meeting. Which I believe we're gonna talk about again today. The adjustments. By the time we add what we're gonna use for fund balance, we're at 26.8 million. About 2 million over the 2022 adopted. And it's about an 8.4% levy increase. The tax rate is hard because it's all over the place, but if you're at 100%, it's less than 1% tax rate. Still massaging-ish a little bit.
Questions on any of that?
And there is that attachment. I know, Joe, you were asking about this, just this kind of a picture where we are, so. For your reference, again, not set in stone, but pretty close.
No questions, we'll move on to number 6.
Yep, just a reminder that any of your town budgets. One original stamped. Me.
Page 12, number 7, reappointment. Yes, we can find it out there. Questions on this? You want to do it? Is Ritter a motion to it? I got a motion by Supervisor Gray. All in favor?
Aye.
Opposed? That carries. Appropriation on behalf of the CIP. $17,000.
Yeah, so, there was money, cash that was still in that fund. We're closing out the fund. We had budgeted 98,000 to use this year. As revenue to offset our serial bond payments. This is just kind of housekeeping to shake that up and close out that, CIP fund. So that'll get paid to the general fund along with the other budgeted funds. So be a little bit more.
Any questions? Motion. Mr. Ritter King. All in favor?
Aye.
Opposed? That carries. Number 9, appropriation for the hospital. Yep, extra money we.
Yeah, this is just housekeeping. Basically, this is, we had increased the amount that we're paying over to the hospital. So this kind of makes the hospital budget look right. So.
Is this part of that? A few months ago, we asked for 7 million, 2, 2, and 3.
Yeah.
Is this part of that 2 million?
Yeah, so we appropriated it on the general fund side, but I was kind of holding off for the hospital side, because I didn't know what else they were gonna need. So I'm like, all right, let's at least take care of this, so.
We have a motion by Supervisor Davis. Any more discussion on this? All in favor?
Aye.
Opposed? That carries. Number 10, appropriation.
I know.
The board of elections.
This is for their postage grant they got from the state. They're gonna use it this year, so they need the money in there so you can do it, so this is where she put the money. I talked with Jim Shook about it, and if they don't use it all, they should be able to use it on. But, that's some. I think help with the absentee ballots and the costs that associated with that.
Motion to support the grant. All in favor? Opposed? Thank you, Bruce. And number 11.
Right, I just wanted to let y'all know that we actually got paid. Our first project that we submitted July 2020. Yeah. So we did get payment for that, that was about $1 million. We have other projects that were started with the hospital, they just kind of got left out there because nobody would communicate back with us, the turnover there, whatever, so, we saw some communication that they're closing the timeframe, you know, what's reimbursable and how much. So we reached out to Mark and have been working with Mark on the agency staffing, because I think there's definitely a, you know, we should get paid for that because a lot of it's COVID related. I mean, we had to get rid of nurses, it caused a shortage, so I thought, I had to reach out to Mark, see what can we do, you know, give us all that agency nursing invoices, we'll get something going with FEMA, so we had about a week for the deadline. So Mark got working on it, he brought over this thing, or what you call it, and I say on Thursday last week, Dee and Caleb and Stephanie, you could see smoke coming out of our office trying to get thousands of invoices uploaded to FEMA website. So, we did 2 years worth of invoices, and Mark assures us they weren't claimed anywhere else. He's got the nursing home ones that he was working on because they were claiming them somewhere else. But right now we've got $4 million sitting in a FEMA, looking for FEMA grant reimbursement. I don't think we'll get all of that because we have to directly tie it to COVID. So Dia's been working really hard on getting data and staffing and you know, how many employees did you have? How many employees does nurse hours work out to? Where's that ground like with our current staffing or what our staffing was? What were the drivers? What were the spikes? I mean, they have been killing it, and why not work hard, try to get some of that. I mean, agency nursing, that's what we keep hearing. And what are we doing where we, you know, let's try to get some FEMA money to help because it's definitely COVID related. So that's in process. Just had a conversation with Mark to make sure we can make our case to say, well, usually we spend 200,000. This is very simplistic. 200,000 on the agency nursing, then COVID hit or like this. And then that mandate hit where you had to be vaccinated, we lost staff, and then it went up higher. Basically, very simplistically, we're going to try to come up with that argument and see what happens. If we can get $1 million, if we can get $2 million, it's better than nothing. And, you know, this is something we've been trying to get from the hospital since Merlin was there and he didn't have time. It's just, you know, we just make time. You work, you do it, you make time to do it. So that's what Dee and Caleb and Stephanie did last week. So it was in and ready by the 31st. That was our deadline, so 2 days. So pretty excited to see how this goes.
Mr. Chairman, I would like to commend Sharon and the union for watching them for this. Watching this COVID hit over the last couple of weeks has been amazing. And I think by living it in, my right to this by the 30%, it's 100% pay. We don't have to do a match.
Right.
So that's outstanding. That's you know, like anything, yeah. It's better than what we were doing. You guys are right on top of it.
So I'm glad that we had the cooperation too, right? So,
Greatly appreciate it. I know there were a few emails going.
yeah,
It was timely having your new staff.
Yeah.
Work and,
Exactly.
already being in those positions. I had a conversation with Lee about this, I don't know, it was Saturday. When we were looking for the money for the hospital thing.
the 20 day.
We had, someone in Albany working every
Administrator.
right. And just thinking, you know, with this FEMA, I mean, are there more FEMA claims that we? No, so this is gonna be the last. I'm just thinking, you know, Dee was talking about having to make a strong pitch for it and what our circumstances were. Is it, you know, beneficial to have someone other than just our congressional or Senate people advocating for us? Should
I don't think any much from what I've learned with FEMA, who is first in the USDA when it comes to dollar for dollar, penny for penny, piece of paper. You know, directly related to the event that they're, you know, it's the event, which is the code, you know, they have code for it. And you guys have probably dealt with FEMA occasionally over the years, but. It's not so much as we need someone to help rules them with our theory, it's. Is this acceptable? Is this an acceptable expense? Do you have every piece of paper? And. What is the calculation of how you're claiming that? I think some of the, because we were, you know, we've done a lot of research and we're like, okay, well, how did some people get money? What were some of the ways they went about it? And they did it by percentage of COVID beds that were going, and they took percentage of that. I think you just have to keep pushing. I mean, we worked so hard to try to get that Trudy robot thing reimbursed by FEMA. They said, no, we're gonna, and that makes no sense to me. I mean, they wanted to know what latitude it was on, they wanted to know, I mean, it was ridiculous. Literally, they wanted to know where on the latitude of the globe it was on. I don't understand all this, but we complied with everything, and we did 2 appeals. Took wording right out of the FEMA website and said, this is what this machine does. They're like, no, I can't, they're just something.
I didn't know it would help to spend 50 or 100,000, hiring somebody to pull together an argument. If it would get us another million or 2.
I think their argument would be the same as our argument. Okay. I mean, they're gonna.
Well, I don't want you here to spend time explaining it to them. They just.
Well, that's just, and we get some of the argument, we have talked to Marcus, let me know if you have another idea, or, you know, in the hospital world, what else can we use for statistics? I mean, we're definitely covering all bases, but.
I'm glad you mentioned the appeals too, because I don't think everyone feels.
You know, we've been appealing like crazy, and we get some of it, I think, we got a couple hundred thousand from appeals that we made. But.
Yeah, the main, I think the goal was a true.
Like $100,000, really? Well, I'm glad we did, because we kind of started more demands, they're like, we want new doors, and I'm like, wait, put on the brakes there. I just. It's not free money, is all I'm saying, and unless
Never
we
is.
take after it.
It never is.
And never, yeah. I just wanted to provide that, I'm happy that we've. Going to help out a little bit. With that agency nursing piece that I know is been. Running the hospitals. Anyways.
No more questions, we'll move on with the agenda. Award.
Yep. Every procurement policy shared with department heads and
everybody that worked on it, and we haven't heard anything back as far as what they were doing, so we're gonna present it as it was worked on, and there are further amendments to be made. Should be adopting the revision deal anyway, so. This just gives us to our next.
Anybody have any questions or comments? Thanks. Supervisor King. There any no questions or comments? All in favor?
Aye.
Opposed? Carried. Two.
And this is the breakdown for those towns with villages as to what the distribution is going to be of your semi-annual mortgage checks.
Questions or comments on that? Great, and that motion by Supervisor Williams. All in favor? Opposed? There, number 3.
Let's do 3, 4, and 5 together. And I will say to you that the attach, I don't usually attach them, but I like the way Pam attaches them, and I thought in this instance, we would try to start doing that. These 3 salary schedules reflect the 2.5% cost of living increase and the compensation committee results going into 2023.
Any questions on 3, 4, and 5?
Just by way of clarification. Jail administrator.
There's nothing on there yet for
Right, so everybody knows you're gonna have that. So.
Yeah, there were,
Sheriff's.
it would have been the secretary to the sheriff that typically follows the road patrol, that and look at that schedule, it shows the 0 increase. And the jail administrator follows jail employees 0. But everybody else follows CSEA, that's why they got the increase.
Just so, didn't. You're 110% right, it's just, you're gonna have to go back and.
It is what it is.
Yeah. And that's tradition, not required.
Right, because we did it last year, right? That was last year.
Right, so
Last year, we gave Sheriff Rudolph an increase.
No, he didn't take his,
He didn't take it.
eventually took it,
but not,
but not right out of the gate.
not
He
one.
did eventually take one, yeah.
Money, I couldn't remember. I know one year that it came in, like, it was one of those, they came in late.
So when it comes to the sheriff's office personnel, we really have 2 questions, whether, whether we want to follow the tradition. Not have to say yes. And then we need to amend what we're going to do again when that's seen. And for those 4.
Well, no questions, is there a motion? Supervisor Davis, 3, 4, and 5. In favor?
Aye.
Opposed? Good. And number 6, local ID.
Yep, it goes with everyone on schedules D and I who have a term of office.
Questions on that? Motion by. All in favor?
Aye.
Opposed? That carries. Okay.
Wait, I have 2 more.
Oops.
Laptops are in, I was going to use them today, but then it seemed obvious to me that I needed to give some people some instruction, and I didn't want to, finance committee to do that, so I'm gonna pick out a few individuals that typically take a paper agenda and pull them aside, and their touch screen computer, so it ought to be fun. And we'll save on some paper, and I think it'll be super easy. I mean, six. I'm gonna figure out where I'm gonna set them in order for people to walk in and grab them and set them at their desks, and just. I don't know, it sounded all good up until yesterday. So, I was just making an announcement. He said, and then one more thing, we said that I'm trying to do rock, paper, scissors, and we just can't, so we'd like to close the office today. Excellent.
Sure.
Motion, go ahead.
Sure.
Motion by Supervisor Renner, or like, first off, or the board's on, close that. Happy Thanksgiving. All in favor?
Aye.
Opposed?
That's me.
Here we go, Cheryl. This should be I've got nothing on here. Still like you. Get the ball rolling on. The town manager. I haven't heard much feedback from anybody. I don't know what's the words. The only thing, anything like.
Feelings. I think it's time that we go forward with this. We've been talking about it for enough years now. We haven't had one in what, 20 years, 25 years?
So there was a process, we said, we created the position and then.
There is one created, there's already one created.
It's still there. Okay. Then we could what if we serve.
Is it still good though? I mean, that little lot had some language in it that's about it. Having to be renewed or something.
Yeah.
Yeah.
I think it's still.
Yeah, we can.
Well, we're gonna have one legally on the books right now. You have to do your local login.
So
We would make sure that,
that's
yeah.
valid and then set up a search committee. I mean, I know that
So. It's all good question.
Well, I know when Ian was here last month, I guess it's first. We talked about first like deciding what we were looking for. And what our priorities were. Asking our departments. You know, what they would foresee that we were doing and how they could help, how that person could help them further their agenda or whatever.
So would that be rewriting the job
Right.
description then?
Yes.
Right, and it was kind of like, I think you mentioned like our strategic plan, what's our strategic plan? And that's what that person is going to, he's gonna be the one to implement our
Most,
failures.
yeah, most county managers handle the budget. We have a budget officer, so that would be one less thing that they would have on their agenda.
Well, now, she already has her.
7 years.
We may want to have that person closely with her to.
Well, you can have them work closely with her.
But
It wouldn't be the budget
I
officer.
it would use an option. I mean,
7 years.
Or that.
Right, I mean, we have a civil service position that exists in our civil service record that defines the job. I think it's outdated. If I may suggest that maybe a circulation of that old civil service description, so that it can be reviewed or updated and correction or adjustment. And then, in addition to that, we need a job duty statement or job description, which the board had asked for one to be drafted about a year ago, which I circulated out. And then at the bottom, there were several questions about, you want this in there, you want that in there, but maybe we dust that off.
Yeah,
As a starting point, I think you really got to define what you want first.
But I think we also have to find a process, I think we do that as a. Find that job description and then form it. I think the problem is we haven't had anybody really take the project and make it. A priority, it's always been there, but no one's got the build drawings and we have. It's pretty motion.
I just suggest this follow the main procedures we follow for all other jobs.
Given the fact that this one may actually happen local law to create it, when the others don't require local law. And I believe that back in the day when the job spec was created, because if you compare the job spec that was with the local law, that local law created the position, and I think that the job spec was a result of the local law, not the other way around.
Pretty generic,
Yeah.
pretty general. But if I could suggest, as Mr. Farber mentioned, any job hiring stuff, there's a committee, we get specific thing, initially, and then it comes back here, because unless all 16 supervisors want to work on this, weekly or monthly basis. To see that happening.
let's go on this road again and have Mr. Farber dust off what he's got.
Get with
And let's look at the
Send it
local
back.
law, and the local law, we need a copy of that, see what.
Discussing it today, probably. And then we'll need to decide salary range. And then how we want to undergo recruitment process. We're going to get it early. Why did that?
Well, the last one we had, because I wasn't there for any of that, you still had the HR department, you still had the budget office, correct? When you had Fabio.
No, civil service personnel and the treasurer's office handle the budget. Treasurer.
Okay.
budget office. Got it.
But basically it was, he didn't do, that person didn't do the budget, and that person didn't do HR stuff, right?
DeFebo.
Hmm.
DeFebo.
Yeah, that's all right, thank you.
You
I'm
are,
just wondering if, you still had those other departments, kind of.
And they did purchasing now. Yes.
he was a purchasing officer.
And then
Becky,
Becky.
Gary.
after one of the jobs became so overwhelmed, it's necessary for the board to create a purchasing officer. We pay about $57,000 a year.
Who is that?
But,
Okay. Say, do you know?
Anyways,
I'll be happy to dust those off.
that's out to everybody. And then, we'll discuss. Yeah. So everybody good? And maybe, more about that, I will see that. Okay.
Sure, we're gonna send a local walk out there. Okay.
All right. You. Off-track betting, there's, I'll move on to the agenda. Not page 14, off-track betting. No. New resources. Yeah, Christian Phil. Principal clerk. That'll January 1st.
To upgrade her employee and then going to the policy. I'll move that.
For retention, right? Any questions on this? All in favor? Opposed? And, number 2, 3, human resources are. That's. First one to set the salary or the hourly rate at $17 per hour. And, lump sum, to remove them. We've got the board of elections. Any questions on those two? Motion. Voting for 2 and 3. All in favor? Opposed? Carried. Appropriations, 4, 5, and 6. Number 4 is the cover winter salaries. And medical and hospital also.
What's it for?
Number 5 is unused benefit time. We know that unbudgeted benefit time. And these are mainly.
Well, the number 5 is when people leave, you pay them out there, unused and approved. We don't budget for that. So we had people leave, so we had to pay them. Number 4 represents increases and the position that was created. And we just set the salary again for 1. And then number 6 is additional expense to overtime due to the large number of backlogs of the administrative on weekends. We didn't hold any for a long period.
Thank you. Okay, is there any questions on 4, 5, and 6? I'll entertain a motion by Supervisor Becker. 4, 5, and 6. All in favor? Opposed? Carried. I'm on page 15, Bureau. Appropriation. Appropriations for the new sports permit. Appropriation for school transportation. And the appropriation for school tuition. Any questions? 1, 2, or 3? Motion. Motion, Supervisor Graham. All in favor? Opposed? Motion carried. Number 4, position filled, Social Service Department. Replace Heather Sheehan. Question on this one? Supervisor Grant? All in favor? Opposed? That carries. Appropriation, 50 grand for cover expenditures of the ESPGB grant. Any questions on this one? Supervisor Jacoby? All in favor?
Aye.
Opposed? Carries. And mental health, I got an appropriation of 9,000 to Justice State Aid. Motion or appropriation. Follows, I think salaries. I 1,200 appropriation. Mental health state aid, $1,000. Motion.
Move it. These were all state aid adjustments. Got more money.
All right, motion by Supervisor, any questions? All in favor?
Aye.
Opposed? Take care. Now on to public health. The keyword left on it's create fill for a 3-year account clerk. Just need to create fill for jail medical. Just going to create fill for public nurse. Public 2. And number 8. Top page me. This is create fill for public health. Yes.
I'd like to point out that we in directive number 6, 7, and 8. I don't think you did any of these, but I'd like to point out that the grades that are being proposed, grade 20, grade 20A, and grade 20B currently do not exist in Schedule A. They exist in the hospital. So what your Luigi and I proposing here is to create the identical wage without any changes or increases, and just mirror them over in Schedule A, so that the same wages exist for the lowest on the county side and hospital side. So I think it's completely appropriate, but I want the committee to know that the proposal is going to create a new salary grade A. I have conceptual ability to do that, but it isn't as done yet. But I thought it was important to make sure you do that.
So these are going to be done contingent with a contingency on the.
Well, if you approve it, I'm sure that we're going to be able to make this happen. I mean, the wages already exist. They just don't exist on that particular schedule. It's a point of clarification that I thought.
Well, thank you. Yeah, motion by Supervisor Davis, 4 through 8. Any more discussion on these? All in favor?
Aye.
Opposed? Carried. The planning department. Supervisor Roberts, the following, advocate for the restoration of the 25K appropriation request for the Arts Council. And that, it's an increase of 10K over what they're currently budgeted for. Is there any discussion on that?
Let's move to the big board,
Arts Council for next year.
What were they budgeted in prior year?
15,
15,
even 15.
And we budget this,
they
year.
wanted 25 this year.
They were asking for another 10,000 for 25.
So they're getting in the same 15.
You asked me to reduce it back to the 15,
15.
which I did,
Yeah.
and then you were ready to discuss it.
My problem with this is the narrative that Jay gave us last week in planning. I don't have the numbers in front of me. I'm gonna guess at the numbers. They moved to Perry because they had to, they moved out of the park, moved to Perry. They didn't want us to do anything about going to the fairgrounds and continuing to have the same number of vendors, sort of cut the vendors back significantly 2 years ago, last year, 2021. And a lot, so that cut them like 30 grand out of their budget. And then they found room this year to do up it and couldn't get vendors back. Get back up to the numbers they had in previous years. I say it's due to their fault, not to the taxpayers. And their last two fundraisers in their narrative said that they basically flopped on one, and the second one they canceled because they didn't get any donations to have an auction. And I have a problem with the fact that,
They have a big auction this coming Saturday night.
huh?
They have a big auction this Saturday night.
Okay, well,
Just these back.
in her narrative, she was explaining losing money. And my comment is, why do the taxpayers have to cover where they have been losing in their past fundraising experiences? Why the taxpayers are the ones that pick that slack up?
You're expressing your opinion. We understand that. I don't think few people realize the amount of work and effort that goes on at the Arts Council. And I would ask the chairwoman of the board, she doesn't listen half the time anyway. Becky, did you read the letter that,
Yes, I got it here.
did you read it thoroughly?
Pardon?
Did you read it thoroughly?
I did, well, it was from the town, it was from the Paris schools.
Correct. From
They talked,
the Paris School Superintendent.
yep. It was at your request, that it said, you know, to write this letter. It was sent to you and you can send it to me. And it says, you know, imagine the different programs that the Arts Council does. It's, and that's through the grants that they receive from the state. That's, one of the regulations of the funding that they get from the state is they turn that money over, but they do manage it. Talks about the Baylor Scholarship for Music and Performing Arts. For one scholarship is awarded each year to one high school student living in Miami County, which is supported in studies in music and performance arts. The Arts Council paid Creekside Fairworks, visual arts scholarship, and it's actually donated by the Creekside. It's a scholarship to local master of fine arts for crafts, culminating with an exhibition of work produced by the master. The Rising Star Art Grant, the scholarship is awarded annually to the young artist who plans to produce and sell visual art as part of their future livelihood. And an instrument exploration scholarship, scholarships for students between the ages of 10 and 16 who wish to learn an instrument. And it was on to mention that the Arts Council hosts shows that feature young artists in our school. I think many of us have gone over there to see the art work in the walls and the award ceremony over there. High school art exhibit is found at the Arts Council. Countless students and families attend shows, receptions, and annual art camp provides only to engage students with smart enrichment opportunities. Can't provide a positive outlet for student engagement during summer recess. And he goes on to say that the Arts Council attracts visitors to our county and exposes residents to a spectrum of cultural experiences. Arts and craft show brings hundreds of vendors and thousands of patrons to our region over the holiday weekend in October. Ours are an invaluable part of our communities and springboard for rural investment in revitalization. Goes on to say, I respect the awesome responsibility the Board of Supervisors has during the budget development process. Every aspect of the county's operations is examined for effectiveness and efficiency. Please consider the role the arts play in Lyman County when considering appropriations for the upcoming year. As a lifelong resident of Wyoming County, father of a future performing artist, the superintendent of schools, who understands the importance of the arts and the lives of our students, I give my complete support to the Arts Council respectively as a county to consider its budgetary needs. Doesn't mention an increase in their budget, it just mentions that we consider them in our budget.
There you go. I'll grab it from the answer.
Yeah, it's what was made in yesterday.
Is that our your email?
Answer the part of the hours. And then was sent via
Okay.
So Becky, what's your take on it?
What's my take? I sat on the Arts Council for probably 6, 7, 8 years.
On the board of directors?
Yeah. And I feel, I honestly, I feel there could be more, push, if you want to say, for get sponsorship to the Arts Council. I know I was involved in one. And I felt it could have been handled better. I'll just leave it at that. Because I think it would have been a great opportunity for getting a large amount of funding for the Arts Council. If it was presented, coming from a business background, you have to remember when you're asking for sponsorships, you have to paint the picture as to what is in it for the council, how it's going to benefit them. And that was not done in a manner that generated the funds. But I think it could have been done. There was a lot of discussion prior to and it could have been as much as $10,000. That's most of the time. So I feel that that should be explored. And also the fact that it's at Village of Perry. I can see why the Perry School would write the letter and that. I can understand the Village of Perry writing the letter too, because it's a rough benefit for having the show there. I would like to see it go one more year and maybe look at this in the next year. I would. Is it about me? Our agency sales.
Was there anything, I don't go to the planning committee meeting, so I'm not sure. Was there anything in their presentation or request that mentioned if they make money off the transportation part of the arts festival?
Money for the transportation, they got donations for that. It's $35,000 for the transportation. And they got donations of like 22 to 25, somewhere in that vicinity. And then But the vendors paid, made up the difference to pick up that 35,000 to pay for the transportation.
I paid $10. Yeah. People pay $10. They charge me $10 to ride the bus.
Right. But they charge you $10 to ride the bus, and that's all split between the Rotary and the fire department, the Arts Council at the end. But they had donations for some of, provide for some of the buses too. See, if you had it someplace else, it maybe it worked, maybe it wouldn't, but there was a lot of people volunteered their time for that thing.
To run.
Yeah, that get paid as one dime.
That's what volunteer is.
Yeah. So, but if they had it where the fairgrounds, maybe they wouldn't have the number of volunteers that they get when they brought in Rotary and fire department to help with this.
You would need people riding buses because they wouldn't need to ride buses.
You would think they wouldn't charge somebody out there $10 to park? Of course they would.
But yeah, there's somebody out there,
Yeah.
but I mean. Us the ball.
Well, it's charged for parking.
Because that's where they make their money. That's the biggest fundraiser the Arts Council has all year, that they gotta make their money from someplace.
Well, that's when they moved the area and dismissed the fairgrounds. They cut their numbers way back in their vendors. Now they can't, they get their numbers back this year. And they did have more spaces.
So they did it the first year because they didn't know, how it was what it is.
They had moved down the fairgrounds. And they cut back 30 grand worth of vendors. Last year. So they turned away $30,000 last year. They haven't paid versus that. So I'm sorry, that's my opinion. I'm not talking about that, but if there's a motion,
Perry did put a tremendous push. No one else did put a tremendous push like Perry did. I know that. And a lot of people like it in Perry, a lot of people were like it at the fairgrounds. There's no denying that. But no director of any that works any harder than the Arts Council director down there. I don't think I know it. The hours they put in, tremendous amount of hours, even as fundraisers Saturday night at the cheese factory.
The thing of it was, it doesn't make any difference where they moved it to. They used the ambiance of the park is lost because they were turning cars away at the park the same weekend they had the thing at the Arts Academy.
they had to move either way.
Yeah, it wasn't their fault. So.
Right, it wasn't their fault either way, I understand that. But. If it kept the vendors, the number of vendors going. So, anyways.
The county's a recipient of the sales tax now. They weren't previously.
Right. We need something about the fairgrounds. Any more questions or comments? Do I have a motion?
I'd move to increase it back up 5,000 to 20,000.
You know, motion by Supervisor Brett to increase it 5,000. What is it? Yours.
I don't have one, so.
Sorry. I got a motion by Supervisor Brett to raise it 5,000 to a $20,000 total budget. Any discussion on that? All in favor?
Aye.
Opposed? No.
Like 2 eyes. And the rest are yours.
Yeah, Roach and Brett with the ayes.
I don't know. What's that?
No, Ellen and I.
I'm sorry,
Ellen, Frank.
Ellen.
Yes, I am. You know, you drew. So.
Two are added. I've got a no on Kale Davis.
I guess,
You guys, you're a no.
I guess I'm like,
And then King's a no, Becker's a no, Jacoby's a no. Is that right?
Yeah,
Okay, so it is, 3 to 5. 2, 3, 4, 5. Peter.
Okay. Moving on in the agenda. Public works, buildings and grounds. We have $3,601. Cover increase in salary for. Salary in for all. Let's see, after also. Any questions on this? And a motion by Supervisor Brick. Any discussion? Aye. All in favor?
Aye.
Opposed? Carried. Okay, public safety sheriff. Yeah, 3 appropriations. One for the to replace the money for the floor total. One for gasoline, to cover the gas, that's what it comes to here. Over figures. And the bottom one is to purchase gift cards for the annual shop at the top at the Warsaw Walmart. Yeah. Any discussion on these 3? A motion by Supervisor Becker. All in favor?
Aye.
Opposed? That carries. Emergency services, we got appropriation for appropriate Walmart grant funds to cover the cost of an AED. Appropriation of $49,000 cover the cost of truck. Consultants for implementation of TAM team. Great. Can't remember what TAM was.
No, it's that, terrorist threat.
Terror
thing.
some terror threat.
I'm moving.
Now, it's not the word terror, but yes, there was stuff. I knew it was. All right, anyways,
Terrorist assessment,
management.
something like that.
All right,
That's one is the district attorney, I'm sorry.
no, okay, so we'll do 4 and 5 together for emergency service. Is there any discussion on these 2? Get a motion?
I'm moving.
By Greg Brick. 4 and 5. All in favor?
Aye.
Opposed? Those carried. And then number 6 is for Medicine Secretary, preventive program coordinator to correspond with grant money. Any questions on anything? Motion. Supervisor Duran. All in favor?
Aye.
Opposed? Thank you. Is there anything else for finance?
Right, just one thing, I continue to review, the telephone from wild invoices from the hospital. I'm on page 40, 70 pages. Might be good for everybody else to take a look at this. My biggest question is, where were these bills? Because the first bill was submitted April 3rd. And I don't think that that's our policy. We were, the bills weren't due by this board until spring 22. And they're incrementally dated. So it's just an unusual situation. That's all I'm saying.
It really is, and it needs to be questioned why we had not received these bills from that far back.
Right.
Or did somebody receive them and not bring them to our attention,
Well, I mean, that's
you know,
what happened.
yeah. And what are we paying for now? No, are we paying these old bills? Are we not paying them twice, are we? You know, and you don't,
They've been better.
they've been vetted, okay.
We are bad.
Okay, but why weren't they brought to our attention? That is,
Fine.
I think if everyone could look at them, they'd find them very interesting. But it's a lot of reading, takes some time. And there's 70 pages, I'm on page 40.
Anything else for finance? We're adjourned. You.
Mm-hmm. Mm-hmm.